Welcome to Kids Matter. I'm Dr. Elisa Minkin. As a pediatrician, mom, and grandma, I understand how challenging it can be to help our kids grow into their best selves. We are so much more powerful together. Here, I will be sharing the knowledge and wisdom of a wide range of people who understand and care deeply about children. I'm hoping for your input as well, because kids really do matter. They are our future. Welcome back to the Kids Matter podcast. Is it true that all health stems from the gut? Today on this podcast, we're talking with Dr. Kristin Struble. Hi, Kristin.
Hi.
She is a Phoenix-based pediatrician with a focus on functional integrative medicine and a passion for nutrition that goes back to her days in biochemistry. From her residency at Phoenix Children's Hospital to becoming a national voice on pediatric health, she's here to show us how to optimize our children's health from the inside out. So welcome, Dr. Struble. Thank you so much for joining me today.
Thank you for having me. This is so fun. Thank you.
It is fun. And once we start talking, we may not be able to stop.
Yep. I imagine that's the case for sure.
Yes.
We could talk to you all day.
Yes, two pediatricians, and we not are just pediatricians, but we align a lot. We're both really, really passionate about helping parents raise truly healthy children with a focus on nutrition and other important healthy habits. So I want to dive right in and ask you, why do you call yourselves a gut health detective? What is that?
Again, that stems from my days, I think, in undergrad, where nutrition and biochemistry were very much aligned with kind of the evolution of my thought process. And then when I got into medical school, Andrew Weil, I consider him the father of integrative medicine, actually just started at the University of Arizona giving lectures at our med school. And I was able to listen to some of his lectures, and I guess my passion even continued to grow from there. So I actually did an internship out here in UCSD with a professor who was at the forefront, I believe, there in gut health medicine too. So just continuing into residency, pediatrics, nutrition, prevention, starting at the beginning, I just fell in love with more of the gut focus. And when I started in practice, I was telling you about just even looking at formula and watching the effects on newborn babies and trying to look for pattern recognition and seeing just minor changes that you could make, seeing how that it could not only change babies' angry, irritable bowel from horrific to better, and watching skin manifestations improve. So with that, I'm like, all disease begins in the gut. And Hippocrates, the father of traditional medicine or allopathic medicine, said that all disease begins in the gut in 460 AD. And I truly believe that's the case.
I did not realize that is really very before his time, because now this is such a super, super hot topic. Yeah. I want to start with the babies, because you and I know as pediatricians, we spend an inordinate amount of time dealing with baby gut issues. And so I want to hear how you handle it. I've heard you speak before about talking about when a mother is breastfeeding, about her diet, and also about how that affects the baby.
So what I've noticed, again, pattern recognition is for many years, when moms are breastfeeding, I notice that if they're big consumers of cow's milk in particular, not necessarily even dairy products, that it's not uncommon for those babies to develop sensitivities, fussiness right around 3 weeks of age. You have the perfect baby until around 2 weeks. And then all of a sudden you see this evolution and I'm more fussy. Mommy's having to hold them all the time. They're eating to self-soothe. So around 3 weeks of age, that's when it exponentially takes off. And so oftentimes have moms come in around 3 weeks just with their shoulders high, or at their 1 month visit just stressing, and you can see it. And you go through those symptoms of silent reflux or colic or irritable bowel or angry bowel and find out that, dive into mom's diet, and more oftentimes than not, they're big dairy consumers. So with that, then I modify their diet and they get better. So I'm going to back up. What I recommend to my moms very strongly is that they limit their dairy. So they do dairy light, and in particular, avoid cow's milk, because I don't know if you've noticed it, but many of my colleagues, even in my practice, we've noticed an increase in melanotic or horrific stools, mucousy, green, and then they evolve into bright red blood. And it seems like it has been worse than it's ever been. So to me, that
Sad.
says we need to back up and say, how can we ward off evil spirits by preventing the evolution of these very angry guts? So I do talk to moms about their diet. And then also with that, highly processed foods, if we can try to get them to eat more whole foods rather than going for the easy stuff like nutrition bars. And even, I'm not a big fan of protein shakes, really trying to aim for a wholesome food. When you read the label, there should be few ingredients and you should be able to pronounce them. And then I really just encourage drinking lots of water and staying away from, again, more dairy products in general. And then I always recommend to moms to be on a probiotic themselves. And then if their babies develop that angry gut, reflux, colic, I don't care. You can just tell when they're going down that path. I do have one probiotic that I really found in the last several years to seem like it works better than anything. That's made by a company called Claire Labs. I have no affiliation with them whatsoever. We do sell it in our office because it's hard to find and you don't want to buy supplements on Amazon and it has to be refrigerated and it's not like we're making a windfall. It's just I like the parents to be able to get it on the way out.
We're going to say from the beginning, we're not here to give medical advice. You can mention something, but that doesn't mean that we are advising you.
Right.
I've used
Right.
BioGaia, which I
It's a
think
good
has been
one.
rebranded, Gerber Soothe,
Yep. And that's
you know, an
L-reuteri.
L-reuteri strain that's in Claire. Is it called Claire?
Claire Labs. It's Klaire Labs. It's a very common nutraceutical company. They make pretty good products. It has a wide array of seeds that I plant in your, tell you to plant in your baby's garden. So it's not just L-reuteri, which I think L-reuteri, I think BioGaia, and then Gerber's product, which I think Gerber bought
took over. Yeah.
Yes. And then BioGaia has it back on the market. But anyways, I like Claire Labs. I think it's a little bit, it works a little better. And again, this is not evidence-based. This is more practice-based, art of medicine.
Exactly. Everybody, it's not just a science, it's an art.
So
different doctors will have different, ideas, and it's not necessarily right or wrong. So that's really need to be clear about that. I'm not even sure though that it's moms who have more dairy in their diet. I think there's also a genetic predisposition. And so if you have another sibling with it or the mother had it, I think you need to think about it. And to be clear, when the baby already has symptoms of that milk protein intolerance, they have to be, the mother has to be completely dairy-free, not dairy light at that point.
Completely. When you see that at 3 weeks, I make them go completely dairy-free. But from the beginning, as I talk to them, I actually tell them about why and talk to them about how important it is for their gut health, because their gut health is directly impactful. And then if I do have a mom and who has their firstborn did have a pretty bad gut, with the second child, I definitely will advise them on their diet and say how important it is in the third trimester in particular to take a probiotic and to really try to make certain that they're eating more of a wholesome, clean diet. And then fast forward, when the baby's born, I tell them to just be dairy-free completely. And again, that's based on my recommendations. I've been doing this a long time and it seems to be working well, but I'm not doing my own research. It's more my practice.
What do you do for soy? Because the soy protein and the dairy protein, casein, are similar.
That's a really great question. I never recommend soy formula. I never have. But in terms of consuming soy,
that's what I'm talking
about. I figured I just want to make that clear too. But because you're right, cow's milk protein and soy, 75% of kids who actually have an intolerance to casein or whey, but casein have an intolerance to soy. Having said that, with moms, I still have them go dairy-free, and then I will talk to them about soy, but I don't want them to completely shut their diet off. I'd rather them focus on the dairy-free and then look for other potential causes if a week or two later they're not seeing some level of improvement. And as you probably know, it takes at least 2 weeks to completely decrease those proteins that are triggering it.
Mother's milk, right?
Yes.
We're still talking about a breastfeeding mom. We're going to need to talk about the formula fed babies.
Correct. No, yeah, exactly. But with soy, you asked about the diet and soy. I don't necessarily say, go off soy too because of the same association that we see with cow's milk versus soy milk formulas. I think we have to be careful trying to limit a ton of other things when we know that they need to be providing themselves with nutrition as much as possible because that's one.
Yeah, and I think it's also tricky because we don't have an accurate test to figure out which babies have this milk or milk soy protein intolerance. It's not an allergy usually.
And in adult medicine and then in pediatric medicine, as time goes on, a lot of people like to do the food sensitivity testing, and there's still not a lot of good evidence-based data there. In fact, if you ask an allergist or a GI doctor what they think of food sensitivity testing, they're not, they will poo it, which is fine. But I have to say, I think it's all up. You can save your money on the microbiome tests that are out there for even babies' poop for adults by simply trying to eliminate one thing at a time versus removing everything. So back to the point of what moms consume when they're breastfeeding and, how to improve the situation. I think we all know that dairy is the number one trigger. So if we're not seeing much improvement, then you can try to eliminate something else. But that makes sense?
Yes, but what I'm thinking about is how do you know that the baby's distress is from the diet? Aren't there other explanations?
Absolutely. There's other explanations. They can be tongue-tied. I do think that there's, like you had said before, there's a genetic predisposition, but I still think that's gut related because to me, all disease begins in the gut. So if you're talking about, I don't know what you were referring to with genetic, but what were you referring to with genetic?
So what I was thinking about is that it seems to run in families to have
Mhm,
this milk
mhm.
protein intolerance. So the mother may have
Right.
had it, the siblings may have had it,
Mhm,
and the mother will
mhm,
come in and say, I started, the alimentum right away because I'm not going through this again.
mhm. Okay, yeah. So you're not saying like there's a chromosomal issue or no, but I
No, I don't.
definitely think irritable
Yeah.
bowel runs in families, and I would
Mhm,
call,
it does.
this irritable bowel in a baby, essentially. That's what I tell my family so they understand what I'm trying to get to and explain it to them. That's not a medical term, but I like to compare it to that. It's irritable, angry bowel in baby. Yeah, if you're tongue-tied, I think that can definitely contribute or be a cause, but I think it's trial and error, unfortunately. I have
That's
them
the
back
bottom line.
frequently and have them back frequently because they need this. They need support and feel, because moms, especially, it happens more commonly with first babies. I'm sure you see that too. And I do think part of that's the energy of being a first time mom, and that the baby feels that mom's nervous because something's going on and the baby's nervous and it just can create some chaos. And anyways, but
Definitely a brain gut connection there.
there's definitely a brain gut connection.
And it doesn't mean that the baby's not struggling and it's not
Mhm.
mom's fault. You can say that
No,
over and over.
well,
So
true, and
hard.
it is so hard, and that's where just having them back for follow-up if it's possible, because it's time consuming, it's hard to get there sometimes for a lot of people, and then it's expensive to come to see us. But I think that those it's such an important time to be told you're okay and we're going to get you through this and establishing that trust relationship and then seeing the outcomes. I I don't know if you're like, it seems like something that is not easily, but for the most part, we can get them through it. I very rarely refer to GI. The GI doctors, when they see my patients, they're like, whoa, because I try to make all the changes before they get there and then handhold a lot, right? That's what we do a lot in pediatrics is handhold. So I don't know. It's a really beautiful thing to see the ability to help really change a gut so profoundly. And having mommy be a huge part of that is what a win for her to be able to be a part of that.
And I think having it, high up on your differential to think about
Mhm,
this milk protein
mhm,
intolerance
mhm.
is really helpful because I see, sometimes it's missed because they're just saying, oh, it's just colic,
Yes.
right? And then we have
Mhm.
to talk about the formula shuffle for just a minute. That's what
Oh,
I call it. And
yes. And
we're going to
that's
talk
probably
about,
one
we
of,
talked about breastfed babies, but we're talking
yeah,
about formula now, and that is
yep,
best.
yep.
However
And
you feed
that's,
your baby is best.
yeah, no guilt because that is really hard on moms, especially nowadays. I feel like there's a lot of guilt thrown out there. And I always tell families that my mother she made my formula with condensed milk and rice cereal and God only knows
Wow.
what else. And maybe that explains a lot about me. I'm just kidding. Just kidding. But I would joke with my families because moms need to know that and hear that is that it's not everybody's going to choose to breastfeed. My mother didn't. Back then it was like for poor people to breastfeed, which is bizarre that anyways, but but she did. She made my milk, and nowadays his formula is so much better, and they're trying to improve it all the time. So Gerber's all whey protein. It's now Dr. Brown's. Whey protein's easier to digest, in my humble opinion. And then Enfamil, I think, is the hardest one to digest. And then Similac is a little bit easier. Similac's ready to feed is easier to digest than their powder, or their Similac's ready to feed Alimentum hydrolide is easier to digest rather than the powder because it's protein, or it's potato. The Nutrimogen is casein, but it's hydrolyzed, so it's easier to digest.
Right, so I'm just going to back up just a little bit and make it really
Yeah.
clear that for babies
Yes.
who have the milk protein intolerance, we
Mhm.
recommend a very broken down formula called a hydrolysate, and that is
Mhm.
always casein. It's not whey, but it's very, very broken down. I've heard you describe this like grains of sand. And then there are the amino acid formulas because a certain percentage of babies are sensitive even to the small molecules that they're broken down to. And so those are super expensive, like pure amino and alpha amino, and those are the amino acid ones. And at that point, I send to a gastro, if nothing else, to get the prior authorization of these formulas paid for because they're so expensive. But I was surprised to hear you talk about 100%. The Dr. Brown used to be Good Start Gerber is 100% whey. And it's interesting to me because breast milk is 60% whey and 40% casein. I always thought that Enfamil would be better tolerated because it's 60% whey and 40% casein, like breast milk, and Similac is more tilted towards the casein. But I've also heard parents say the same thing. So
Your explanation was perfect, and thank you for backing up and clarifying. Whey protein is far easier to digest than casein.
talk about whey versus casein and why casein is hard to digest.
It is the source of cow's milk protein allergy or intolerance. It's not the whey that is, and it's just the different molecular structure. But there's many other things in the formulas that can be problematic for the gut too. Um, Maltodextrin, which is a common substitute for the corn syrup solids in the regular US formulas, is still irritating to the gut. There's many components, but casein is the number one trigger, which is why I think if moms take dairy out of their diet completely, and you have to clarify that with moms too, by the way, it's not the butter because there's no protein in butter. And it's not the milk sugar because a lot of moms will be like, I'm on Fairlife now. It took the lactose out. It's the protein, and it's the casein and the protein. You can have an intolerance to whey, but it's more the casein that's the problem. Did I
But
answer your
I don't believe you can use the Dr. Brown 100% whey formula for babies who have milk protein intolerance.
No, you cannot. You can't. So you can't.
It's a spectrum, though. I will say it is on a
Mm-hmm.
spectrum, and
Mm-hmm.
especially because we don't have a test. Do you do guaiac for microscopic blood testing for your babies?
Yes. Mm-hmm.
So I've done it too, but it's not recommended. I just looked up the
Well,
current recommendations, and they're to just, if you have a baby that you suspect has the milk protein intolerance, to either of the mother's breastfeeding to start her on a dairy-free diet, or the baby to put them on a hydrolysate. They want you to do a 2-week trial on, and then they want you to take them off it. I have never, ever done that. I can't imagine doing that to a mother. That to me is not
no.
practical
And
to
a
prove
lot
that that's
of
what it is.
obviously, if it's bright red blood, there's blood in it. But I don't chronically do it, but I'll do it once or twice to confirm it. And what I'm looking at is those babies are typically fussy. So if they have blood in their stool, they're very fussy. If obviously we would be, if they have mucus and or the poop is green, I test it and they're fussy. So my goal would be that, yeah, I would love if the microscopic or the macroscopic poop or the macroscopic blood disappeared, but more importantly, how are they acting a week later? How are they acting 2 weeks later? That's really the critical component, because even if I see blood in the stool via the guaiac 2 weeks later, I'm not going to stop the baby. I'm not going to tell the mother to stop the breastfeeding. I'm just not. I'm going to figure out other things. Like there's a doctor in our office who had it continually happening despite taking dairy out. Then she took corn out and it finally disappeared, but it took a long time for that to be the case. And meanwhile, her daughter was fussy, but not terribly fussy. So anyways, I still think there's some value in guaiac testing. but I don't think it needs to dictate the outcome necessarily.
Right, right. What I was reading is that it can be positive, but the baby may not have milk protein for various reasons, or it can be negative. And I've definitely seen that where the baby does have it. And the bottom line is, like you said before, it's trial and error. I wish we had a better way, but it's really just trying, different formulas or, the mother's diet. But you don't, I'd be concerned about trying to limit the mother's diet with a million different things. I mean,
Exactly. I agree.
that's problematic, more problematic than trying different formulas.
You know what's interesting to me about this very concept, though? So let's say the baby also has eczema, which there is a skin gut connection for sure. That's absolutely that. If the baby has severe eczema at 4 months of age, I know you know this, you send them to the allergist, right? The allergist can literally determine via the tests what mom needs to take out of her diet in order for the eczema to improve. And then also to know, of course, what the baby's going to potentially be allergic to when they start solids. But it is crazy to me to see the profound impact on their skin when the doctor actually figures out, when the allergist figures out what's in mom's diet that's triggering it. Like, super cool to me. But anyway,
Right,
so
and I
it
want to
just,
really, I want to really make it clear that there's a difference between allergic
mm,
disease, which is mediated through
mhm,
the IgE pathway, and the milk,
mhm,
sometimes soy protein intolerance, which is not mediated that way. It's not an
correct.
allergy; it's more of an more of a sensitivity, and it's often outgrown. And allergies may be outgrown, but are less likely to be outgrown. And what you're
Is
seeing with eczema is more likely to be a true allergy, and that's different.
Y- Yeah, I would agree with that. Absolutely, obviously, because that's scientific. But it all too seems in pattern recognition that the kids who have eczema, seborrhea also have reflux, irritable bowel, all these things. So there's got to be some sort of connection there. Is your outcome going to be to develop cow's milk protein allergy versus sensitivity? Who the heck knows? That's going to continue to evolve over time, I think, too, in terms of having more evidence-based data to support it. And I think it'll all be it'll be whittled down to the diversity of the gut microbiome to see exactly what bacteria might be missing or not as diverse in the gut. I don't know. There's a lot to be learned, but at this point, what we have is an elimination diet process or changing the formula or being proactive and having mommies really just be careful with their diet in general. So
Right. It reminds me of the story of somebody's drinking a cup of whatever and they're saying, take the spoon out. It's hurting your eye, take the spoon out. Like if the formula is causing a problem,
yeah,
change it. If the mother's
change it.
diet is causing a problem, change it
Right.
and don't overthink it. And, we're learning so many things and it's so exciting, but there's so much more we don't know.
So much more we don't know. But I think it's exciting times with where we are now versus where we were 10 years ago with the gut
Right.
microbiome. And, it's just crazy how there's just so many institutions after the newest data and research on this very subject. You see it in Medscape talking about how there's a link with psoriasis in the gut and schizophrenia in the gut and just all these asthma in the gut and using antibiotics and how it can trigger IBD in the future, or there's an association. I think we're definitely on the forefront of not only knowing how to prevent the diseases, but how to treat them based on what's in the poop. So,
Right. And I'm thinking again about eczema we talked a little bit about having a true IgE mediated allergy. We're sending them for testing, but lots of eczema is not associated, right, with
oh yeah,
an
for sure.
allergic trigger, but it's
Mm-hmm,
still inflammation, right?
mm-hmm.
And so I wonder if
Yep,
that's what you're seeing connect to the
correct,
non-allergic sensitivities.
correct.
What's going on? Just
I think that there's still that whole what the leaky gut concept is.
you can
I
tell my
believe in
listeners
that.
though.
And yeah, it just essentially it means when you have chronic inflammation in the gut, it triggers leakiness. And so it allows those proteins into the bloodstream, and then the body thinks that those are foreign invaders and creates antibodies against them. I think that inflammation is inflammation, and if it's there, it's going to potentially trigger cradle cap and eczema and reflux and all these things we see in little ones. And then if they have reflux, you and I know that there's an increased potential for ear infections. And if your gut's also angry, you're more likely to have chronic congestion. And if you get a cold, you're going to end up with those ear infections. So it's all, I think it all really stems from the gut. Trying to find a beautiful balance of the garden and the gut early on is critical. And I do think that starts with mommy's diet and breastfeeding, or making sure that the formula the baby's on is being digested, because if it is, then whether or not it has palm oil or any of the other things that are talked about right now in the media, if it's being digested, I think the gut is much more, it's not leaky, it's much more diversified. The microbiome is more like a protective barrier, like it's supposed to be, rather than leaky and open with lots of channels, allowing things that shouldn't be getting through to get through. And that's like a huge, that's the foundation of functional medicine, is that very concept, which is, that's what I love.
Yes, and I agree. It's really, really important. And I just feel so much for parents nowadays, because as I told you before we started, I did a rabbit holing on formula. And oh my gosh, there's so many different brands with so many different claims. This one has that, but it has this. And like you mentioned, the palm oil, it's a thing to try to avoid that. And but it's in this formula that's good for other things. It's just, work with your pediatrician. And if your baby is thriving, don't stress it, because there are so many good, safe formulas. And if it's working for your baby, I personally would not. I wouldn't change it, and I wouldn't go rabbit holing, obsessively researching, because you could go crazy. I mean, I'm not a new mom, and I was going crazy.
Yeah, and you can also trigger their gut to be unhappy if you change them from a formula, to your point, that is working well, but you freak out that it has corn syrup solids or palm oil or whatever, and you put literally, if they're digesting it well, don't change the formula. If it's there, it is. I feel bad for families that are on Instagram that are constantly inundated with this stuff, so it's confusing. But
right. What about baby constipation? Because we talked a lot about milk protein intolerance, but baby constipation is something we see a lot of too. And we'll say constipation. A lot of times we might not call it constipation, so I'll let you go there.
I would say that if a baby is constipated, they're not. I wrote a children's book about poop, right? How to be a poop detective. It starts when the baby's born. Everybody focused on the baby's poop from day one. And if a baby develops constipation, it means the formula is not being digested. I think it's pretty unusual for babies should not be constipated at all. So if you have one that's constipated, there's either a neurologic issue with the gut, sprungs can be developing, because at that point their poop should be liquid or seedy or all. But if they are constipated, they are absolutely, I'm sure, fussy as heck. And so you would change the formula. So I would, if you ask me which one to change it to, I would, if you're going to do a regular formula that's not hydrolyzed, then I would do Dr. Brown's that used to be Good Start, because it's whey protein only. That would be my recommendation.
Right. And I was thinking of Little Miss Muffet sat in her tuffet eating her curds and whey, right? It's the casein that clumps into curds. And I believe could be related to the constipation. But first, we forgot to define what is constipation. I was alluding to it before, very subtly, where a parent will say, my kid's constipated. They haven't pooped in 48 hours.
Yeah, that's a very good point, because obviously you and I know if they're breastfed, they can go many days without a bowel movement and then have those punamis. But if they have if they have really hard poops, they're straining to actually go. They're tearing, they're developing fissures from tearing through their anus, then that's a problem. That shouldn't be happening. But if they're breastfed, we expect that. It's not uncommon with a growth spurt. So
And sometimes, especially with the more broken down formulas, it's similar to breast milk, where they don't poop right away. So constipation is defined by to pass stool, not a liquid stool that just took longer to come out before the punami stage. I'm stealing that one.
I like to use terms that are like our 3-year-olds than our 5-year-olds. So I'm just kidding.
Oh no, pediatricians can talk about poop all day.
We could.
But we weren't supposed to talk so much about it, so I'm going to move on. I promised you. I want to talk about feeding older babies. Do you recommend a probiotic for all kids?
Not necessarily, no. I only recommend it if they have gut issues to begin with, or down the line if they have gut issues. So if they come in with abdominal pain and any complaints or any suggestion that their gut's off, then I will have them go on it. And absolutely, if they are on an antibiotic, I always put them on Fluorostor, which is Saccharomyces boulardii. It's yeast, so it's non-pathogenic yeast. It protects the gut. It's the only one with data it's showing that it supports the gut while you're on an antibiotic. So I actually take it every day. It's great for IBS too.
Fluorostor is a brand name for that?
Florastor, Costco.
Fluorostor.
The best price.
Yeah.
And it comes for kids. There's a baby one, and then there's a kid one that's a packet. You can mix it in water, or there's just the adult capsules. But I'm religious about it when patients are on antibiotics, and it's pretty huge. So Saccharomyces, if I have patients who have diarrhea of any sort, I have them start on it right away.
So let's talk about feeding a baby. We're talking about weaning to solids now. What are some of your tips and tricks for that?
I don't know if your recommendations have changed over time, but I still am a fan of starting out with purees. I know that's like kind of go against the grain right now. Everybody's really into solid starts, any baby-led weaning. And I just, for me, I still think it's good to introduce a sour, salt, sweet, and savory to the palate, and purees first, and then build on the purees, a little bit of texture. And then if you want to start introducing more of the baby-led weaning, that's fine. But I think Solid Starts is a great app. And I don't know if you follow them, but they're all evidence-based and they do a great job. But I always say that, to families, to exercise caution. No one's the expert. CPR training is not a bad idea, all that stuff. But the biggest message would be one that I'm sure you agree with, which is avoid highly processed foods, avoid the snack foods, avoid I would say even Cheerios, cereals in general we used to recommend Pinch or Grasp, and working on that early on in my career. But I think the more we can avoid kind of addicting them to the highly processed foods, I think the better, because I think it does start early. But anyways,
right.
So
and it can be in moderation too.
Correct.
I would hate for parents not to give the kids a chance to do that Pinch or Grasp, because that's a very important fine motor skill.
It absolutely
But also, I thought you were going to
is.
say choking hazards. Watch out for choking hazards, please, for years.
Which is why I love Solid Starts, because as you probably know, they show you exactly how to cut up the food at each age so as to avoid the potential for choking. Obviously, there's always still going to be the potential, but that's one of the reasons what they do. But I do feel like it's really important also to push the message, because I hear this a lot. I was told that between 6 months and a year, the solids that I'm giving my baby aren't really for calories necessarily. It's more to introduce them. I don't agree with that. I think our whole goal is to try to increase the amount of calories and decrease the amount of liquid calories, or the solid calories over time, and decrease the amount of liquid calories between 6 months and a year. I don't think it's just for fun.
For one is just for fun. You don't agree?
No, I think because my goal is I want them to be eating their calories like humans should by the time they're a year. I think the vast majority of what the calorie source should be is from food, not from what we're drinking, but from what we're eating.
You know what? I first of all, I like a combination of baby-led weaning and purees. And I will tell you, every baby is different. I'm watching my 2 youngest grandchildren learn to eat, and they are the opposite. One,
That's awesome.
One is really loves to eat, went right from purees to, regular food. I was actually watching a 7-month-old baby at a wedding the night eating like actual like chicken. Didn't have teeth, So some babies are really great eaters, and then, my one of my other grandkids likes to taste things and experiment and play. But we keep saying food before one is just for fun, because it all ends up on the floor. But I want to remove. I want to remove the anxiety that, you're not doing it right. Like that today, parenting is like an Olympic sport. It is just insane, the amounts of pressure. And I want that to stop. There's such a wide range of normal. If your baby is growing and gaining, that is the main thing. The only thing is, though, that sometimes what happens is, and I see this more with the bottle-fed babies, that they don't get a chance to be hungry, because they're on the bottle, and then the next thing you know, they're 1 and they're drinking 40 ounces of milk a day, and then they go to cow's milk. So you have to talk about cow's milk.
I actually love your point, which is why I think that it is important to have that conversation of the seesaw, because if they are not decreasing the amount of the formula, they're never going to eat more. They
Right.
know when they're hungry and full. So I always talk to them at 9 months. I really want you to decrease the amount of formula to like 15 to 20 ounces, even
Right.
though the can says 28 to 32. I want
Right.
you to focus on giving your kids solid foods. And between now and a year, so in a month, I want you to decrease the bottle and so on and so forth, so that by the time they're a year, they're actually off it completely. So that's when I say go to water. I'm not a cow's milk for kids fan. I don't believe kids should be drinking calories. I think they, at a year, I personally think, and this is not trying to guilt, shame, or tell anybody they're wrong if they disagree with me, but I think kids should drink water and eat their calories. So they want to have cow's milk here and there or anything to drink for fun later down the line, that's fine. But that's wholeheartely what I believe to be the most sound decision.
I do exactly the same thing as you, except for I don't say no milk. I'm not as extreme as you on that, but I see your point, and I quote Frank Oski, who I've heard you talk
Yep.
about. Or I didn't realize how anti-milk he was. I just quote his line of cow's milk is for baby cows.
Yep.
Because I see, such an overload of cow's milk when they go to it and they're
Mhm.
used to having their diet be primarily milk. And so I also start at 9 months and say, I want no more than, 16 to 20 ounces of formula, because you cannot have more than 16 to 20 ounces of cow's milk. That's what I say, but that is the outer limit. But I also say no milk, fine with me.
Yeah, for sure. No, that's, again, it's actually, I think bottom line is that's the beauty in medicine too, is we're all going to have a little bit of different viewpoints. We all have our hard, firm foundations of medicine, like vaccines and obviously pool fences and things that we all agree with, but that's the beauty of it.
We're talking about cow's milk, and we don't have exactly the same viewpoint, but we do align pretty closely.
Oh,
I don't know. I don't know that our research is so clear about, say, dangers of cow's milk, but we don't need cow's milk. I like how a gastroenterologist I know says, this all a beverage. It's just a beverage, and water is the best beverage.
well, I like
But
that
but
gastroenterologist.
some kids really don't eat, and it's really a problem. We need to take just a minute to talk about kids who did not transition to food. And I'm seeing kids who may be neurodivergent, but sometimes they're not. They don't have any particular issue. They just haven't made it to transition to solids. I don't know if you're seeing that.
Here's the one thing that we know is that cow's milk is one of the more common causes of anemia in toddlers. Even Dr. Oski talks about that in his book. I think anything that can, and it's not because they're over consuming it so they're not getting calories from other sources. That's always a possibility. It's because it causes microbleeding in the gut and it blocks the absorption of iron. To me, if there's something that can do that, I think that should be a very big red flag that it shouldn't be consumed. And there's a big difference between cow's milk itself and dairy products. Dairy products, because they're either fermented or broken down, they're much easier to digest. That's why I'm like extremely passionate about it. And the number of kids that come into the office with chronic abdominal pain and constipation and are put on Miralax. Yeah, Miralax is going to help, but you have to go upstream and say why. And cow's milk is probably the most
Constipating.
common. Yeah. So to me, it's always a signal that if your poop is off, it's a grade of what you're consuming. So you have to look at your diet and say, hey, is there something that I'm consuming that might be causing my IBS, my constipation, my vitiligo, my psoriasis, my acne, whatever? To me, again, if there's something that can cause anemia, we also have to ask what other things could it be causing? What other, because it's inflammation in the gut, right? All disease begins in the gut. Inflammation is the trigger.
Yeah.
One of my favorite gastroenterologists actually talked to me about, and she's somebody who endorsed my book. She said that there's, and you know this probably too, I keep saying this because you are very well read, the casomorphine breakdown of, there's actually an opioid stuck to the casein molecule. The idea is that it's supposed to addict the baby to the mother's milk. When babies are switched over to cow's milk, it's somewhat addictive. And so that she actually talked about that, and I thought that was interesting. So anyways, you can fact check me on that one, but
Yeah, but
I'm
Yeah, I'm an autism mom, and so there was a whole gluten, casein-free diet, and you haven't
Mm-hmm.
started talking about gluten yet, but I want to really be careful here because
Mm-hmm.
parents
Yep.
are anxious enough,
Yep.
and a lot of kids are on that beige diet, and
Mhm.
you're just trying to make it healthier. I don't want
Correct.
parents to go, "Oh my God, milk is inflammatory. I've got to get my kid 100% off milk." First of all, again, we're not
Mm-hmm.
here for medical advice. Talk to your pediatrician, number one. And number two, it really depends. There are some kids who totally can't tolerate it, and it can make all the difference in the world. And there are
Mm-hmm.
some that are just less would be more. I try to get the less is more. That's what I work on.
And that's such a reasonable thought process. I would have to say to you that to me that it is really important to not make moms feel guilty. And trust me, I wasn't a perfect mom. I'm still not a perfect mom. You
There's
know,
no such
I
thing.
always
There's no
no,
such
I
animal.
always no, and I always said my kid will never eat hot dogs. My kid will never eat Chick-fil-A. My kid will eat salmon every day. My kid will do this and that, hard fine line, and really judgmental. And you're until you are the parent of a toddler, you are the parent of a 5-year-old. And so the most important thing to do is love your child. But to your point, try to make it healthier. Try to like make little substitutions here and there that might make a big impact. So yeah, we have to give ourselves grace, but then if there are certain things we can do, just substitutions with the realistic meet people where they are kind of approach, I think makes sense.
Yeah, I was starting to talk a while back about kids having trouble transitioning to solids. I see a lot of that, and we actually have a occupational therapist who specializes in feeding issues come to our practice once a week, and she's also a lactation consultant, so she works with the new moms with the breastfeeding, but she also helps these moms help these kids who are struggling to transition. I'm not sure what's going on, but I will say that trying to, start solids in a way that is not anxiety provoking for the child or the mother, starting in that window when they're ready, between 4 and 6 months, and not waiting too long, and not getting stuck on the purees. The problem with the puree approach, right, is I see some parents, I don't know if they're worried about choking or they just don't want the messiness of the baby feeding themselves, and these kids end up struggling to move beyond the purees. It may be because there's so many pouches out there. I don't know what it is. Are you seeing this, or is it just me?
I have theories about it. I think that the kids, if you want me to share my theories, but I think that the
Yes.
kids who have more refluxy, angry guts that probably have either silent reflux or real reflux are always going to have more of an oral aversion situation because they're
Interesting.
kind of
That's true for
used
sure.
to feeling like they're gonna. So these kids in fast forward, you know, who have these feeding issues then require somebody to almost do trauma therapy with them to help them
Hmm, hmm.
overcome the texture issues, right?
Right,
Oftentimes those kids have big tonsils. They have from the silent reflux,
right,
snore. They've had a
right.
history of ear infections and multiple antibiotics and yada. Yeah.
There's definitely kids with feeding disorders, and my daughter had one of the worst ones I've ever seen. She had all those things, the tonsils, the reflux, everything, and wasn't able to eat food for 4 years. It's very unusual.
Is
This is
she
my
the
autistic daughter. So
is she the autistic? Well,
yeah,
see,
yeah.
is there
So with an
that's where
autism,
I
you can see such severe, and
mhm.
I recommend getting services through early intervention or, preschool services, school age services, whatever, they'll often cover it the younger you are.
Was she your
Feeding therapists, gastroenterologists, all those people get a team approach because that's a feeding
mm-hmm.
disorder. That was
Mm-hmm.
actually not what I was talking about earlier. I wasn't talking about feeding aversions or feeding disorders. I was talking about just kids who didn't learn how to eat.
I wonder though, I do feel like there's oftentimes a very strong correlation though with kids who are neurodivergent and or have sensory issues, not necessarily the spectrum of
Hmm,
things, if you will.
hmm.
So,
And gut things too. They often have gut things.
right. And when they're babies, I find that there's definitely, was your daughter easy? Was she like your easiest child, or was she,
No,
as an infant, was she spitty, colicky, fussy?
all the
Did she?
things.
Right. I
Yeah.
mean, so that's where I do feel like it starts at the beginning. I think not again. I feel like this space is so awesome and exciting because I think we're just going to continue to build on what we know. And anyways, so
No, it's
I'll leave
it's
it
true.
there.
We knew less. This is, over 30 years
Hmm.
ago. So we knew less then than we know now. but it still can be really, really hard. I've seen, children on the spectrum get scurvy. I
Yeah,
had one had to
yeah.
get a G tube, a tube fed because they absolutely couldn't eat. So that's the most severe end. And these are often kids who do, have the beige diet, very limited, or drinking a lot of their calories. So that's where, I think starting early is best, and getting the help you need, building that team is really important if you're in the feeding disorder world. But I am concerned about overuse of those pouches.
I agree. But I also don't want to judge moms either. Sorry,
Right. Fair.
any mom feel badly because they're using the pouches, but I do, it's just like thinking about it. Like, how can we make little changes? That one I would use as a last resort.
Almost done. I want to talk for a few more minutes about diet and mood and behavior because we didn't yet discuss that. I actually had someone ask me recently what probiotic is best for a child with anxiety. And I was so surprised by that question because I wouldn't think that that would be how you would use a probiotic. Have you ever used probiotics for mood?
I would say it would be part of the equation. Yes, it's not necessarily obviously you're going to treat everything, but I think it's all about rebalancing the gut. And that's not just with a probiotic, that's with just, again, doing a food diary and saying, hey, there's little fit changes that we can make to maybe modify your gut a little bit. And then if you can get them to take an omega-3 and a multivitamin, also ask them about other lifestyle, how's sleep, what's going on an hour before bed, what's the bedroom look like, are your child getting exercise, or tell me about devices, tell me about, are we socializing, are we getting out in nature? So would I say that probiotics going to help treat anxiety? No, but it is definitely something that I would consider using as part of the process in terms of healing. So
Right. And you don't have a specific probiotic for that. It would just be probably Floristore for a
I
kid.
would,
Like,
yeah, I would do Floristore for sure. That would be my favorite go-to. And omega-3s, I think trying to find one that the child will take, because the majority of the time the taste is always the issue. And that's with even a multivitamin. So it's trying to find one that, if the kid has sensory issues, doesn't like the crunchiness of it or the flavor of it, or they don't like gummies, and not that gummies are necessarily always great, but the key is getting them to take a multivitamin, a probiotic, and an omega-3. And I also will use magnesium too. I do think that magnesium plays a part in it too.
especially with constipation.
Yep, absolutely. So you
I
kind of
love
can.
that. You pre-answered my question on supplements, but I want to say something about supplements. I don't know if you have a
Mhm.
special, a place you recommend, but you have to be so careful because
So
unlike
careful.
medication, it's not FDA regulated. And, I've always checked for like third-party testing, stuff like that, so that
Yep,
you're getting
yep.
actually, hopefully, what you pay for.
Yeah, I absolutely have to agree with you there. You can go down the rabbit hole of supplements. I've seen it even in my journey when I first got into functional medicine. I was so excited to have all the names of all the different companies, and I do have favorites and whatnot. But what I realize is, if you put people on too many supplements, you're going to mess up their gut. You have to be so very careful about where you're getting them from. Do not buy supplements on Amazon. Get them from the manufacturer, or Full Scripts, which is like a Walgreens for multivitamins and for supplements. But none of this stuff is really monitored by the FDA like it should be. So yeah, third party testing is really important. It's the Wild West. And the other thing about that is all the testing being done. When I first got into functional medicine, I was so excited about doing all of the poop testing and the food sensitivity testing. And there's so much out there with that now. And I really caution people on that too, because it's expensive. And I think you're going to get more bang for your buck just sitting down with your pediatrician or your provider and going through your lifestyle and your timeline, and trying to figure out if there are things that you can do to all the things I talked about: sleep, exercise,
Right.
socializing. So that actually all affects your gut if it's right.
A
Because
million
again,
percent.
it goes back to the basics of what we know in looking at diet and lifestyle and saying, how can we help people move forward without expensive tests and all these
Right.
supplements? There's a place
This
for
is
some of it, but
Yes. This is true holistic medicine, and I agree
Mhm.
with you 1,000,000%.
Mhm.
And we could just keep going on and on and on. I want to
I
stop
know,
right
I'm
here, though.
sorry.
Thank you so much for doing this with me. I think we're going to have to do part 2 because there's more things we didn't get to talk about.
I know. Part 10 will be.
We didn't even talk about sugar in kids. Somebody asked recently
Uh,
about, is it true that
yeah.
sugar causes hyperactivity or causes mood problems? We didn't
Yeah,
even
that's
get to that.
we'll get to that be in
But
part 2 because that is a
but
huge one. It's,
yeah,
you know,
but a too long didn't read or didn't listen would be it's not that simple, you know, like listen, limiting sugar is great. Can you, you know, if you can do it, but going back to those basics,
yep. Yep.
it's
Yep.
just someone once said, or maybe I said it, I don't remember, I'll take credit.
I
Sleep,
can't
diet,
wait.
and exercise are the Holy Trinity.
Yeah, I love it. No, that's true. But at the same time, if your kid has Sour Patch Kids and goes trick or treating and has chocolate milk as a treat, like all it's what happened to moderation and everything. Like my mother said that, you said that. The hard part is it's there. That's a whole nother topic too. Why? But
Yeah, but
anyways,
small changes and don't
small
judge your
changes,
kid. Don't
little
judge
Eddie.
yourself. Life
Yeah,
is
but
too hard as it is for us. We got to give ourselves grace. Thank you
yeah,
so much. I really appreciate it. We'll have to come back for part 2.
yeah, exactly. Have a really good rest of your day.
You
And thanks for
too.
having me.
Thank you for listening to Kids Matter. Raising healthy, happy children takes a village, and I'm grateful you're part of ours. If today's conversation resonated with you, please share this episode with another parent, grandparent, teacher, or anyone who cares about kids. Together, we can build the supportive community our children deserve. I'd love to hear from you. Share your thoughts, questions, or suggestions for future topics at kidsmatterpodcast@gmail.com with no exclamation point. Your voice truly matters. Until next time, keep advocating for the children in your life because kids really do matter. They are our future. I'm Dr. Elisa Minkin, and this has been Kids Matter. Please note that while I am a pediatrician, I am not your child's pediatrician. This podcast is for informational purposes only and does not constitute medical advice. For any medical concerns or decisions, please reach out to your child's healthcare professional.